shape. Good afternoon.
Good afternoon.
House Speaker Adrian Jones, Senate President Bill Ferguson, and I just signed emergency legislation into law which allows for the transfer of up to $50 million from the Rainy Day Fund for our state's emergency response to the coronavirus. Given the rapidly evolving nature of this threat to public health, it is critical that we have the flexibility to immediately access these resources. And I want to sincerely thank Speaker Jones and President Ferguson and all the members of the Maryland General Assembly for working together with us and for expediting this legislation so quickly and unanimously passing it. I want to thank you both very, very much. All of us at the federal, state, and local levels are working together, and I think this is just a great example of how seriously the state of Maryland has been taking this crisis. And it shows that government at the federal, state, and local levels are working together to respond to this threat in a cooperative and coordinated manner. We are continuing to hope for the best while we're also actively preparing for the worst. At this time, I'm going to provide some up-to-the-minute updates on COVID-19 and our response. Yesterday, state health officials identified 2 additional positive cases for the coronavirus in Maryland. One individual is a woman in her 80s. She's a Harford County resident who contracted the virus while traveling to Turkey and is currently being hospitalized here in Maryland. This appears to be the first case of COVID-19 anywhere in the world to be associated with travel to Turkey. Second case is a man in his 60s. He is a Montgomery County resident who contracted the virus while traveling to Thailand and Egypt. He was briefly hospitalized and now is quarantined. In both of these most recent cases, our team at the Maryland Department of Health believes that there are no major concerns regarding potential exposure risk to the community. Neither of these individuals attended any gatherings or events. And in addition, the Maryland Department of Health has determined that there is no connection between these 2 individuals and the 3 positive cases that were confirmed last week. So all of our cases at this point are related to foreign travel. And so far, we have no cases of transmission here in the state of Maryland. Our state now has 5 total confirmed cases of COVID-19. After receiving the test results for these 2 new individuals, the Maryland Department of Health immediately notified county health officials, along with Montgomery County Executive Mark Elrich and Harford County Executive Barry Glassman. And I want to thank both of them for joining us here today and for their cooperation and that of their local health departments. I also want to provide an update on the first three confirmed cases of the coronavirus, which were all contracted on an Egyptian cruise of the Nile River. The same ship that is also connected to 12 now confirmed cases in the Houston area. We have just today discovered that 6 additional Marylanders recently traveled on the same Egyptian cruise ship, but on different dates, traveling between the dates of February 19th and March 4th. Our state health department has been in touch with all 6 of these individuals. 2 of them are experiencing symptoms. All 6 of them, out of an abundance of caution, are in self-quarantine, and all 6 are going to be tested for COVID-19. The U.S. Department of Health and Human Services has also notified us that 12 Marylanders are aboard the Grand Princess, which, as we speak right now, is being docked off the coast of California. All 12 of the Marylanders and many of the other U.S. citizens aboard that ship are currently being transported to military bases in Texas and Georgia for examination and to be quarantined. We have been told that the 12 Marylanders from the cruise are not currently exhibiting symptoms, and we are working closely with our federal partners. I just returned from an hour-and-a-half meeting in the Situation Room with Vice President Pence and top-ranking federal officials. We had on conference call 48 of America's governors. As of this hour, more than 111,000 people in more than 100 countries have been infected by the virus, which started in China. Nearly 3,900 people have died. Here in America, as of right now, there are 600 cases and 22 deaths across 35 states and Washington, D.C. The Vice President and federal health officials continue to stress that as we begin to expand our testing, we can expect the number of cases to continue to rise. And we will begin shifting from containment to mitigation. We also want to make it clear, and this is a bit of good news, that children and young adults are less vulnerable to this coronavirus. In fact, less so than even the typical flu. However, people over 60 and those with underlying health conditions are much more vulnerable and at a significantly higher risk of contracting the disease, with morbidity and mortality rates that are 3 to 5 times higher than most flu seasons. That is why we are advising people over 60 to stay home as much as possible, to avoid large crowds and gatherings, and we are advising nursing homes and retirement communities to closely monitor residents and employees for fever or respiratory symptoms. This problem continues to escalate rapidly. Information is changing not only on a daily basis, but on an hourly, almost minute-to-minute basis. Here in Maryland, we are committed to being transparent, to providing the facts, to try to keep our Maryland citizens fully informed. And we're taking actions based on our detailed planning and making decisions based on the facts on the ground. In order to make those decisions and to leverage all of the state's resources and expertise all across our state, at my direction, we are convening a coronavirus response team comprised of experts in public health and emergency management. The members of Maryland's coronavirus response team will include Dr. William Chen, Associate Professor of Medicine at the University of Maryland, who specializes in infectious disease. Dr. David Marcosi, Associate Professor and Associate Chair of Public Health at the Department of Emergency Medicine, the University of Maryland Medical System. Dr. Lisa Maragakis, Senior Director of Infection Prevention for Johns Hopkins Health System. Tom Igglesby, Director at the Center for Health Security for the Bloomberg School of Public Health at Johns Hopkins. Steve Evans, the Executive Vice President of Medical Affairs and Chief Medical Officer at MedStar. Linda Singh, the Interim Executive Director and CEO of TEDCO and our former Adjutant General of the Maryland National Guard. And Dr. John Loom, a geriatrician at Genesis Healthcare. And we will be convening an emergency meeting of this coronavirus response team tomorrow. Also tomorrow, we will be meeting with representatives of the state's long-term care community to make sure that we are taking every precaution possible to protect Maryland seniors and retirees. I will also be convening an emergency meeting of my entire cabinet tomorrow for a thorough briefing with state health officials and a discussion of our statewide response efforts to COVID-19. As you can see here today, this is an all-hands-on-deck operation, and state government remains fully operational. Today, the Department of Budget and Management is moving to Level 2 of its pandemic policy. We are issuing guidance to cancel all out-of-state travel for all state employees and advising all agencies to prepare for a period of mandatory telework to limit the spread of the virus in our state. I continue to encourage Marylanders to stay informed by visiting coronavirus.gov. That's coronavirus.gov. Maryland residents can also get the latest updates at health.maryland.gov/coronavirus. And if you have any questions or concerns, residents can also call 211 to connect with a helpline representative to get information and community resources for the virus. With that, I may ask Senate President and the Speaker if they have any comments, and then we'll be happy to take a few questions. Mr. President.
Thank you, Mr. Governor. Thank you to your administration. Thank you, Madam Speaker. I think the pace at which we moved to implement and enact the legislative initiative to reserve funding for coronavirus protections and precautions demonstrates the commitment that we have to working together in a united fashion to send the message to Marylanders that we are in this together. We stand here as one body of state government united to show the confidence that we have in the administration's proactive approach to this virus. We've had a number of conversations with Maryland senators, and the message has been clear. In times where it's quite anxious and difficult and fearful, it's very easy to drop into a tribal mentality, a fear of the other. This is the time like none other in Maryland, a place with some of the best global resources on these issues, that we have to be with one another, united, standing firm, and acting in a smart fashion to make sure that every member of our community feels comfortable, protected, and that we are doing things that are reasonable to protect Maryland's future. Again, every member of the Maryland Senate stands. I want to convey the message from every member of the Senate that we are here in this together more than ever. And we thank the governor and the administration and our chamber across the hall for the collaborative approach that they've taken from the very outset to ensure that Maryland is in a good place to deal with this ongoing challenge the best way possible. Madam Speaker.
Just want to thank the governor for keeping the House members, keeping me informed of what is going on early on, so I can convey the information to my members as well as constituents in which we all serve. And I think that's the best way to go. When changes were being addressed, we knew about them. We also can tell our constituents to look on the website for the information, the public service announcements that the health department has are excellent for persons to know what to do and what not to do. Communications is the key, and that's what has happened here with the governor and his team. Thank you.
Be happy to take some question.
Governor, what will the response team that you put together be in charge of, and what will they be doing differently than what the administration has previously done in the last week?
Well, they're going to be advising us and our team. So we already have declared a state of emergency. We already have a Maryland Emergency Management Agency stood up to be able to coordinate all of the different state agencies and to coordinate with all the local governments. The health department is already in complete cooperation with the county health departments and with the federal agencies. But these are kind of experts in the medical field that I think we're just going to rely on them and their expertise because we want the smartest people in the room giving us the best advice possible as we make independent decisions on the ground. I mean, the governors are on the front lines of this in each of their states, and while we're looking to get input from the federal, state, and local government, we also want the best medical advice we can get. And so we brought the smartest people we could find into the room.
Governor, with your meeting with the Vice President today, you have said that the administration is communicating in a way sometimes that you think could be improved. Did you get any sense from the Vice President today that we could see a change on that front?
Well, no, actually, I said that the communication has been great. I mean, somebody asked me about did I think that the president's wording and messaging was the best, and I said I would have said things a little differently, and I wasn't. It's not the way I would have done things. But I also complimented the vice president and the rest of the team at the federal government, who's been very communicative with the state governments, just like we're trying to do with the local governments. I mean, this is the second time in a week that I've been in the Situation Room with almost all of my fellow governors across the country, with all of the top officials. And so the communication has been pretty good. I'm not sure all the messaging that comes out of the president to all the media has been perfect, but the cooperation from the rest of the entire administration, particularly from the leadership of the vice president, from HHS, from CMS, from the CDC, from all across the administration, we've been having great cooperation and great communication.
Governor, was this meeting any different from the last? You have been to 2 meetings there. Were there any differences this time? Was it longer?
The first meeting was about 30 minutes. This one was an hour and a half. And as I shared with you, there was a lot more information, and it was a lot more. It was a much higher level. They've raised the level. They asked us to share some of this information that I shared with you today about the fact that things will ramp up, that with the expanded testing, we should expect to see higher numbers, that this is spreading, that it is going to shift from containment to trying to deal with the situation on the ground. They talked about the worldwide situation and how it went from Italy to all across Europe. We talked about everything from the global perspective to what was happening in each of the states. We heard from some of the governors that are facing much more difficult situations than we are at this point. Governor Inslee was on there talking about the state of Washington and how they went from just a few cases to, I think, 134, 140 something, and it starts to escalate pretty rapidly. So it was a serious discussion, I think, with all the top folks.
Governor, I have a question about Christ Church in Georgetown.
I'm sorry.
I know that that's a church that draws a lot of parishioners from Maryland, it's close in the suburbs.
Yeah.
Is there any way that have you reached out to that population? Is it possible to do so? They've been asked to self-quarantine.
Yeah, so we've had some discussions about that. Of course, it's in Washington, D.C., so the D.C. Health Department is taking the lead, and they have responsibility for reaching out to the parishioners of that church, and I think they have been in communication. But you're right. I think a number of Marylanders do attend services there, and so through our health department will be cooperating with D.C.'s health department, and the safety of Marylanders and our neighbors in D.C. is important to us. Sorry.
And you inform people to be calm during this crisis. What about medium and large events that will be going on here?
Yeah. I think we're going to take that on a case-by-case basis, but as I mentioned, one of the pieces of advice that came from the Surgeon General and from the Secretary of HHS was that older people and people with compromised health situations should avoid attending large events. But for other folks that aren't in one of those categories, I think at this point it's not something that they should be as concerned about.
Governor, many of the General Assembly committee rooms and even the chambers are very cramped. The public's through here a lot. Some of the members, the elected members of the Assembly, are in the age group you referenced. Is the plan now to keep to the current calendar?
Yeah, I think at this point, I think we're just going to take that day by day, and we'll certainly consult with the presiding officers on what their feelings are. But at this point, I don't think we need to take any actions with respect to that.
Governor, the Florida Health Department is requiring anyone returning from international travel to self-quarantine. And given that most of all of the cases here in Maryland are people who have traveled international, is there any consideration to requiring anyone returning from overseas to self-quarantine?
Sir, one of the discussions that came up today, and the Florida governor was on the call with us. It's something that the federal government is looking at, and other governors are are being concerned with and thinking about. But it's not a decision we've made at this point, or other governors. I think Florida's the first one to do so.
Governor, the parishioners in Georgetown were asked to self-quarantine after being at a large event where someone was infected. The CPAC conference took place in Maryland where someone who was infected was there. It was another large gathering. Why isn't Maryland advising attendees to self-quarantine?
Well, it's a different situation in a number of respects. Number one, this was the priest himself who was serving communion to all the parishioners while he was actively sick. So there was more of a concern that he wasn't potentially infecting people, and that wasn't the case at CPAC. The other reason it's different is that the way this is handled is where the person comes from is who handles the case. This is a New Jersey resident, so the New Jersey Health Department is actually the one that takes the lead on this. And so we're working in consultation with them. But this particular person apparently was not exposed to large numbers of people and was in a smaller location. And, it's something we're certainly taking a look at, but they're not the same kind of concerns they have with the parish in D.C.
Last question, please.
Governor, you said people in their 60s should avoid large crowds. I look around, a lot of my friends in this room, there's a large crowd. What exactly do you mean by that? We've got teachers in their 60s that go to school.
Yeah.
We've got professors that go to school, coaches, people, all of us out here. Stay home as much as possible, avoid large crowds. Can I put a finer point on that?
Well, I mean, this is just information I just got on the way here from the White House, and I think these are decisions people will make individually, but it's guidance that comes from the folks at the federal level. It's really, I think the older people and people that are in nursing homes and people who have health situations are the ones we're most concerned about. They use generalizations like over 60, but when you get to folks that are the average person right now that has the disease is 60. The average person that dies from the disease is 80. So, the people that are in nursing homes are the ones we're most concerned about. And people that are, if you're at home, if you're taking care of an older adult, we want you to be concerned about them. But I'm over 60 and I'm still here in this room, so I'm not sure I fall into the category. But we're going to be careful and we're going to wash our hands and we're going to try to avoid contact. We're all bumping elbows here, instead of shaking hands.
Thank you.
Thank you all.
Thank you.